Hello everyone. So in this presentation I'll be explaining about the anterior part of the permanent dentition, which includes incisors and canines. So in the recent NEET examination they have asked a diagram based question, so giving some aspect of the tooth, that is either labial, lingual, mesial or distal, and asking you to find out the tooth. So you need to know some characteristic features of the tooth and distinguishing features which differentiates between the two teeth. So human dentition is of three types. They are termed as heterodont, thecodont and diphyodont. So what does heterodont mean? So heterodont, the name itself suggests hetero, it is different types. So human dentition is of four types, that is incisors, canines, molars and premolars, and thecodont, which suggests the tooth is embedded in a socket, and diphyodont is having two sets of teeth, that is primary dentition and permanent dentition. So human dentition comes under the following: heterodont, thecodont and diphyodont. Moving on to the permanent tooth eruption sequence, here you can see the maxillary tooth eruption and mandibular tooth eruption are different. So in maxilla, the tooth eruption follows this sequence, that is the first molar followed by the maxillary central, then the maxillary lateral, then maxillary first premolar, maxillary second premolar, maxillary canine, maxillary second molar and maxillary third molar, that is 6 1 2 4 5 3 7 8. Whereas in mandibular the sequence is little bit changed, that is 6 1 2 3 4 5 7 8. So please note this eruption sequence in maxillary and mandibular dentition. Moving on to the tooth, that is the incisors are 4 in number. So we'll start with the maxilla. So maxillary has two types of incisor, that is central incisor and lateral incisor. So starting with the maxillary central incisor, this is the labial view or facial view. So these points are the characteristic features of maxillary central incisor. So maxillary central incisor is the widest of all the anterior teeth mesio-distally. So this is the important point regarding labial aspect of maxillary central incisor. So it is the widest mesio-distally of any anterior tooth, and the crests of curvature mesial and distally, this is the crests of curvature, represents the contact area. So in this diagram you can see the mesial outline is slightly convex, whereas the distal outline is more convex when compared to the mesial outline. Whereas the very important point is the mesio-incisal angle. So mesio-incisal angle of maxillary central incisor is sharp, whereas disto-incisal angle is rounded. And moving on to the root part, the root is cone shaped with a blunt apex. So it is cone shape and having a blunt apex. It's not a pointed apex, it has a blunt apex. And the line drawn through the center of root and crown, so when the line is drawn through the center of root and crown, it is parallel to the mesial outline. So it is almost parallel to the mesial outline. So these are the characteristic features of labial aspect of maxillary central. So remember the one point, it is the widest mesio-distally of any anterior tooth. That is the important point. So in all the anterior tooth, that is central, lateral and canine, so widest mesio-distally is maxillary central. So the lingual aspect, you have to remember three important points, that is the cingulum, marginal ridge and lingual fossa. So cingulum is nothing but a smooth convexity which is present on the lingual side, and the marginal ridge are mesially and distally present near the cingulum, and between the marginal ridge there is a concavity called as lingual fossa. So these three are important in finding out the difference between the central and lateral, which we'll come across later. So in lingual aspect, you need to concentrate on the cingulum, marginal ridge and the lingual fossa. So moving on to the mesial aspect of maxillary central, the important point as soon as you see is the cervical line. So the cervical line, the greatest curvature of any tooth is maxillary central. So the mesial cervical curvature is greater on maxillary central than any other tooth in the mouth. So remember that. So the distal aspect is slightly different from the mesial aspect. You can see when looking the central incisor from the distal aspect, it might be noted that the distal aspect is somewhat thicker when compared to the mesial aspect. So thicker because the slope of the labial surface is distolingually present. So more of the surface is seen from the distal aspect. Because of that, it is an illusion that distal surface, that is distal crown, is seen thicker when compared with the mesial aspect crown. So when you know these features of maxillary central incisor, so it is easy to distinguish between maxillary central and lateral. So here is a diagram distinguishing between the two teeth. Here, what differences can you find is the crown part, the labial part, as I already told you, mesial incisor line angle is sharp in maxillary central, whereas in maxillary lateral you can see both the mesial and the distal incisor line angles are rounded. So that is the main characteristic feature between the two teeth. The only difference between maxillary central and lateral is, except the root length, everything in maxillary lateral is in smaller dimension. So I'll repeat it once again. The maxillary central is larger than the maxillary lateral in all aspects except the root length. So only the root length is high or long when compared with between these two teeth. So one more difference you can see in these diagrams is the incisal view. So when you see the incisal view, the maxillary central is more flatter or not much convex when compared to the maxillary lateral. So maxillary central is less convex than the maxillary lateral and canine, which gives the central incisor a square or rectangular appearance. So it has a square or rectangular appearance because of the less convexity on the labial surface, whereas the convexity on the labial surface on the maxillary lateral is much more pronounced. And look at the cingulum area. So the cingulum area also is more pronounced on the maxillary lateral when compared with the maxillary central. So these are the main differences between maxillary central and lateral. The main difference is the mesio-incisor line angle is sharp in maxillary central, whereas both mesio and disto-incisor line angles are rounded in lateral. Except for the root length, the maxillary lateral is smaller in every dimension. And one more important thing is the root is blunt and cone shaped, whereas it is sharp and pointed in maxillary lateral and slightly distally curved. Here you can see the root is straight, whereas in maxillary lateral the root is slightly curved distally. So that is the main difference. When you talk about maxillary lateral, you need to talk about the variations it has. So the variations in the maxillary lateral is very, very important. So the variations are, it is peg shaped with a thin root and small conical crown, and the maxillary lateral incisor may be congenitally missing. So these are the features which differs it from the maxillary central. Apart from the third molars, so these maxillary laterals show the variations much more. So peg shaped lateral and congenitally missing, and the third one is developmental groove on the distal aspect extending onto the root. That is also called as palatogingival groove. So palatogingival groove, congenitally missing and peg shaped laterals are the variations of the maxillary lateral tooth. So moving on to the summary of the maxillary central and lateral incisor. in different aspects. You can see the labial aspect, the crown is longer and wider mesiodistally. So I told you this, mesiodistally wider of any anterior tooth, highest is maxillary central incisor. So whereas the maxillary lateral is, the crown is shorter and narrower. The only superior feature or the highest feature in maxillary lateral incisor is the root length when compared to the central incisor. The root length is longer than the central. And the second difference is the mesial outline is slightly convex with sharp mesio-incisor line angle, whereas the mesial outline is acute and more rounded when compared to the central incisor. So distal outline is more convex than mesial outline in central incisor, and the crest of curvature is closer to the middle third, whereas in lateral incisor the distal outline is rounded and the curvature is at the center of the middle third. The root is shorter with cone-shaped and blunt apex in central incisor, whereas the root is longer with pointed apex and distally curved. So remember this important point. Whereas from mesial aspect, you can see the crown is wider labiolingually with a pronounced curvature of cervical line. So I've told you the cervical line, which is seen in the mesial side, has a greater curvature of any other tooth on the mesial aspect. Whereas in lateral incisor, the crown is narrower labiolingually with the curvature of the cervical less pronounced. The distal aspect has no developmental groove which is extending onto the root, whereas in the lateral incisor, you can see a developmental groove which extends from the side of cingulum from the distal side to the palatal, that is palatogingival groove. And from the lingual aspects, the central incisor has well-defined lingual features, whereas as I told you, there is prominent cingulum and more concavity of the lingual fossa. So moving on to the mandibular incisors. So now we are done with the maxillary central and the maxillary lateral and the distinguishing features between them. So mandibular centrals and mandibular laterals. So the only main difference is the size. As you can see, the mandibular centrals are the smallest teeth in the dental arch. So the mesiodistal diameter of mandibular central is less than half of the mesial distal diameter of the maxillary central. So that small it is. So the mandibular central, important point to be noted, is the smallest tooth in the dental arch. And mandibular lateral, when compared with the mandibular central, is larger in every dimension. So mandibular lateral is larger when compared with the mandibular central. So the main difference you need to find, or you need to distinguish between the mandibular central and lateral, is the incisal aspect. So this is the incisal aspect. Watch it closely. The incisal aspect, when you draw a line labiolingually, so it exactly bisects at perpendicular line. So the mesiodistal line is exactly at the right angle to the line drawn labiolingually. Whereas for mandibular central, that is not the point. So this is not exactly right angle. The reason why is the crown is a little bit twisted on its root base. So this is the main distinguishing feature between mandibular central and lateral when given a diagram based question. So to identify which is central or lateral, so please keep in your mind that mandibular central, when a line drawn bisecting labiolingually, it is exactly at a right angle to the mesiodistal line. But whereas mandibular lateral, it is not at 90 degree because the crown is slightly twisted on its root base. So it is the main distinguishing feature between the mandibular central and lateral. So these are the few distinguishing features between mandibular central and lateral incisor. So the symmetry. So the crown is symmetrical bilaterally in central incisor, whereas it is asymmetrical in lateral incisor. So I told you meso-incisor line angle is sharp, that is 90 degrees. It is somewhat rounding in lateral incisor. And the distal incisor line angle is also sharp at 90 degrees, which is more rounded in lateral incisor. So these are the labial aspects. So it is symmetrical bilaterally. Both mesio-incisor and disto-incisor line angles are sharp in central incisor, mandibular central, whereas both mesio and disto-incisor line angles are rounded in lateral incisor, similar to the maxillary. So in maxillary central, I have told you only mesio-incisor line angle is sharp, whereas disto-incisor line angle is rounded, whereas both are sharp in mandibular central. So the contact area is incisal third for both central and lateral incisor. And the incisal aspect, as I told you, the incisal ridge forms a right angle with a labiolingual bisecting line, whereas incisal angle is slightly twisted on the crown in lateral incisor. So here are some more ways to distinguish between mandibular lateral from the central. So the lateral is larger overall. As I told you, mandibular central is the smallest tooth in the crown, in the dental arch. The lateral is not as bilaterally symmetrical as the central. So central incisor, as I told you, it is bilaterally symmetrical and smaller when compared to the mandibular lateral. And the cingulum on the lateral incisor, that is mandibular lateral, is slightly distal to the center of the tooth, whereas in mandibular central it is located at the center of the tooth, cingulum. So on the lateral incisor, the mesial marginal ridge is longer than the distal marginal ridge, whereas it is at the same level in mandibular central. And the distal proximal contacts are more apical on the lateral incisor, whereas the contacts are on the same level on the both sides, both mesial and distal, on the mandibular central. And the last but not least, disto-incisor line angles are more rounded than the mesio-incisor line angle in the lateral incisor, whereas in the mandibular central, both the incisor line angles are sharp. So these are the other ways to distinguish between mandibular central and the lateral incisor. So moving on to the canines. So whenever we talk about canines, you need to know one thing. So there are totally 4 canines, 2 maxillary and 2 mandibular. These canines are placed at the corners of the mouth. So these are commonly referred to as cornerstone of the dental arch. So this is an important point to be noted. So canines are considered as the cornerstone of the dental arches. So because of the labiolingual thickness of the crown, as you can see in the diagram, labiolingual thickness of the crown and root of both the canines, that is maxilla or mandible, is very thick. So the thickness is high. So because of this labiolingual thickness of crown and root and the anchorage in the alveolar process of the jaws, these canines are considered as the most stable tooth in the dental arch. So apart from the cornerstone, they are considered as the most stable tooth, and they are the last tooth to be lost in the human mouth. So the reason is because of the labiolingual thickness of the crown and root and the anchorage in the alveolar process of the jaw. So when we talk about maxillary canine and mandibular canine, one thing is always confusing is which is the longest tooth. So please go with maxillary canine. So maxillary canine is the longest tooth in the dental arch in the human dentition. So mandibular canine, the crown appears to be longer, which is an illusion because of the less mesiodistal thickness. The dimension of mesiodistal is less, which makes an illusion that crown appears to be longer, or sometimes it is longer. Whereas If both of the canines are given in the options, go with the maxillary canine. So maxillary canine is the longest tooth in the human dentition. So the main aspects of the labial aspect of the maxillary canine is the ridges, the mesial and the distal ridges. So always remember, the mesial ridge is shorter when compared to the distal ridge. So mesial slope is shorter when compared to the distal slope in both maxillary canine and the mandibular canines. So by which you can tell whether it is right side canine or the left side canine. So mesial slope is shorter when compared to the distal slope. So when talking about the lingual side, so the cingulum, and there are two lingual fossas, and there is a lingual ridge in the center. So normally in the anteriors you saw only one lingual fossa, that is in incisors on the lingual side, whereas in the canine you can see a lingual ridge in the center and two lingual fossas on the either side. So moving on to the differences between maxillary canine and mandibular canine. So this slide tells you the main differences between the two canines. So the mandibular canine is narrower labiolingually and mesiodistally than maxillary canine. So this is in comparison with the maxillary canine. So when you compare maxillary canine with mandibular canine is narrower labiolingually and mesiodistally when compared to the maxillary canine. So maxillary canine is wider labiolingually and mesiodistally. So when you talk about the crown, the labial surface of the mandibular canine is smooth and convex, and the labial ridge is not as prominent as maxillary canine. So the labial ridge, which is present at the center, is not as prominent as maxillary canine in mandibular canine. So the greatest faciolingual measurement is greater than the greatest mesiodistal measurement. And when you talk about the tooth root, there is only one root mostly in both maxillary and mandibular canine, but there is one variation that you have to know. The same way that you have learnt about maxillary lateral, which has many variations like peg-shaped lateral, missing tooth, or congenitally missing, or palatogingival groove, the mandibular canine root may be bifurcated. So this is very, very important. When you compare both maxillary and mandibular canine, mandibular canine has a chance of having bifurcated root. So there is a developmental depression on the mesial root surface on the mandibular canine, which is more prominent. But in the maxillary canine, there is deeper distal developmental depression. So that is the difference. In mandibular canine, there is prominent mesial developmental depression on the root, whereas in the maxillary canine, there is pronounced distal developmental depression on the root. And the important point is the cusp tip is displaced lingually. So when you draw a line straight to the axis of the tooth, the cusp tip is present lingual to it. So that is the important point. So the cusp tip is displaced lingually in mandibular canine, but not in maxillary canine. When you talk about the surfaces, the mesial surface of the crown is almost parallel. So this is also a main difference from maxillary canine and mandibular canine. So the mesial surface is almost parallel to the long axis of the tooth. It's not like this in maxillary canine. So the mesial outline is almost straight line. And when you talk about the cingulum between maxillary and mandibular canine cingulum is less bulky and less prominent than maxillary canine. And the last point is the mandibular canine appears more slender and smoother than the maxillary canine in all aspects. So the labial and lingual ridges are less developed when compared to maxillary canine. So because of this, it allows them to be very caries resistant. So these are the main differences between the maxillary and mandibular canine. One is the maxillary canine is the longest tooth in the arch, and pronounced labial and cingulum is present in maxillary canine, whereas bifurcated roots are more common in mandibular canine. And mesial angle, that is mesial surface of the mandibular canine, is almost a straight line and is parallel to the long axis of the tooth. And the cusp tip is placed lingual to the long axis of the tooth. And here also the mesial cusp slope is shorter when compared to the distal cusp slope, which is similar to the maxillary canine. So these are the differences between maxillary and mandibular canine. This is a short note on the cingulum and its situation. So cingulum is present in the anterior tooth. Here you can see it is divided into two, which is when present at the center of the lingual surface and when present at the off center to the center, that is little bit towards the distal surface. So cingulum, the teeth which are having the cingulum at the center of the lingual surface are maxillary lateral, maxillary canine and mandibular central, whereas the cingulum present off center to the distal, that is little bit away from the center of the tooth, is maxillary central, mandibular lateral and mandibular canine. So please note this point. So moving on to the contact areas of all these teeth. So contact areas for anterior teeth are different. So here it is denoted with the two-letter word, that is IJ, JM and JM, or II and IM. So the first letter in these two letters denotes the mesial surface, the mesial contact area, and the second letter denotes the distal contact area. So for example, maxillary central has mesial contact area incisally, whereas the distal contact area is represented with J. That means it is located at the junction of incisal and middle third. So I represents the mesial contact, that is incisal third, and J represents the distal contact, that is junction of incisal and middle thirds. The same way with all the tooth. So this is when seen from the labial view. So remember, although the mesial and distal contacts of the mandibular lateral are in incisal third, both are denoted as II. The distal contact is slightly cervical when compared to the mesial contact. So both are incisal only, but when you see in a microscopic level, the distal contact is slightly cervical to the mesial contact. Whereas on the mandibular central, even though it is both are same, they are located at the same level on the central. But in this both are incisal only, but distal contact is slightly apical. Thank you all. We'll come up with the other video regarding posterior permanent dentition. Thank you.